that, this place that we all have in us. In some level, we all have a warrior in us. We all have a fighter in us. It's in there naturally. But many people have not been told it's okay to be that way, or it's okay to take on that stance. So I'll have people practice that in front of a mirror, either with me there or they do it at home on their own. And within a couple of weeks, their posture, their demeanor, their communication, all of that changes.
Welcome to the Optimum Human Podcast, the show that interviews the world's top experts in fitness, nutrition, mindset, and beyond. Let's get into the show.
Hey everyone, welcome to another episode of the Optimum Human Podcast. My name's Brian McKay, he's Claude Petroulis, and we are the Optimum Human Podcast. Today we've got another awesome guest. Looking forward to talking with Dr. Joe Tatta. How are you today, Dr. Joe?
I'm doing great, guys. How are you?
Real good, thanks. Real good. Claude?
Fantastic. I've got a coffee, so as long as I've got a coffee, I'm good. I'm happy, man.
Beautiful.
So, Brian, I do know that you might have some conflict of interest in terms of business stuff with Dr. Joe. I know you guys are competing. No, I'm joking, but I'll get this thing launched off, and I really want to hear, Dr. Joe, how you got into what you're doing right now. Can you explain kind of your current career and then how you got into that?
Sure, yeah. I have a doctorate degree in physical therapy, and I'm also a nutritionist and practice functional medicine. So I got involved in healthcare because my mom was a nurse, and I watched her go through kind of her own health struggle when I was really young. She used to work on a adolescent cancer hospital, in an adolescent cancer hospital where she worked evenings. So she was, taking care of the kids and the house and the dog and all the stuff that moms do during the day. And at night, she'd actually work the night shift and take care of other people's kids, which was awesome.
Wow.
Although she, after probably about 5 years of doing that and not sleeping so well and, not having the best lifestyle, so to speak, a lot of nurses have have high stress and they work shifts. She kind of bottomed out and, kind of hit this low point. So she quit that job and got a new one and just watched, I watched her heal herself naturally. Just with nutrition and exercise and kind of decreasing her own stress and modifying some lifestyle things. So that was probably the biggest kind of stake in the ground of going into healthcare. The other is that when I was a kid, or a young adult, I should say, I was a competitive gymnast. So I had the exercise part, the movement part, the functional movement part as my background. So those two things kind of came together, and I was like, okay, physical therapy is kind of the perfect blend of health and fitness for me, and that's where I want to go.
Right on. And just, this is kind of in my own little wheelhouse. Do you still practice gymnastics?
I'm 43 years old, and I still take a gymnastics class one to two times a week.
That's awesome.
Awesome.
Now, I don't necessarily advise that for everyone. Sometimes it's not the kind of sport you can just pick up, on a weekend activity, but I started that when I was 3, and I did it all through high school into college. I took a couple of years off in PT school because schooling is just too tough and too rigorous. But then as soon as I graduated, I got right back into it. I found an adult program, and it keeps me healthy and happy.
So you have a pretty developed nervous system then, I assume.
Yeah, some people would say that. Sometimes gymnastics is an interesting sport to watch because some people do really well with it, and nervous system wise, some people actually don't do well with it. So it's really interesting to watch people take that sport on, whether they're kids or whether they're young adults, just give them a try, because you can really see when someone takes on that sport, you can see how developed they are physically, like if they went through the proper developmental phases when they were younger. Mm-hmm. Because if you never went through those phases, sometimes it can be a challenging sport, but it could also be a really good sport for integrating some of those healthy patterns into your life.
Oh, for sure. Knowing how to control your body and just having overall body strength is quite helpful in life and staying healthy.
Absolutely.
Now, Dr. Joe, to get back into the gymnastics a little bit more, do you feel like it could be damaging at all? I know there's some controversy over starting kids off really young into gymnastics and something about growth plates. Are you familiar with any of that controversy?
Yeah, I've seen, it's interesting because I also used to work backstage with Broadway dancers. So I used to see kids who were coming up as, athletes as well as dancers, which obviously dance is a form of athleticism. Like any sport, obviously, if your intensity of training and your duration of training is too high, of course, there are going to be overuse injuries that happen, tendinitis, growth plate injuries. What's interesting about gymnastics is that many countries actually have it as part of their physical education program all the way up to high school. And I think they keep it in there, or I know they keep it in there because it's a really great form of almost cross training. Now, obviously, not everyone's going to become an Olympic gymnast, and that's not necessarily the goal when we do sports or any kind of movement. But I think it's a great way for kids from an early age to develop their muscles, their musculoskeletal system, their neuromusculoskeletal system. It's great for developing confidence, for learning how to take on a little bit of risk and not be risk adverse from movement, because many people are risk adverse from movement. And I also think it's just a wonderful thing as far as cross training, because so many times, I see a lot of kids now in my practice who are in a particular sport, and that's the only sport they do. They do it all year round. They almost never take a break from that sport, which leads to overuse injuries, as well as growth plate injuries that you mentioned. So it's a really great form of cross training.
Yeah, for sure. And there's something to be said for gymnastics as a base, because you can take a gymnast and put them almost into any sport and they're going to excel. I mean, not 100% of the time, but they're going to have a solid base to work from.
Yeah, I did other sports as a kid. I did baseball, I did football, I ran track, and I loved them all. Gymnastics was the one sport that I excelled at, but from what you're saying, it is so true that I was good at those other sports. Like, for instance, track. I was a really fast sprinter in my high school. I have a medal and a record that no one's beaten in my high school to this day. And I really I think I only achieved that because of gymnastics. It's obviously a kind of a very fast twitch type sport. So I think that's why I was able to achieve that.
Yeah, it's definitely gets you one step closer to becoming a beast. Now, I don't want to completely dominate this interview, so I'm going to let Brian ask some questions.
Well, I actually wanted to kind of dive into some pain or some pain science, and kind of what is your description of what exactly pain is, and what does that represent to people?
It's a great question. The simplest description I think everyone needs to just kind of, put under their belt is that pain is about protection. Now, with acute pain, that obviously makes a lot of sense. Obviously, if you fall and you sprain your ankle, or you break your leg, or if you fall and you cut your knee and you're bleeding, you obviously tore some skin. Obviously, that pain is telling you, okay, something is injured. And there's probably a period of time where you should rest, or you should obviously have relative rest, or rest the particular part of your body somewhat, so that healing can occur. And, the period of time that you rest obviously should be as minimal as possible, because we know that healthy movement on every level is actually a positive thing for healing. When it comes to chronic pain, we know that signal, that harm alarm, if you will, can be turned on or persist after the point of tissue has healed. So after the tissue is healed, so let's say you sprained your ankle and you had some swelling and bruising there, but now it's been, let's say, 5 months and that pain is still there. We look at that as chronic pain, and we look more toward the nervous system, and we start to identify, okay, maybe there's something going on in the brain and spinal cord and the nervous system that's keeping the pain turned on.
Okay. That's really interesting. So I do know that the nervous system can kind of keep sending these signals, and it's also apparent in people who have lost limbs. They can have this phantom pain in their hand that they've lost. So how do you as a professional not only assess this but also delve into helping people? Like I don't want to say, give me how you do it, but like, where do you start?
Yeah, it's a great question. Physical therapists and other, health professionals will see people with phantom limb pain. Obviously, that occurs after an amputation. And what's really interesting with phantom limb pain is that the brain still thinks that the limb is still there. So it's still paying attention to a part of the body that is no longer there. And the reason why we know this is because there's something in your brain called the sensory and motor homunculus. That's kind of a big fancy word, but it means that there's a physical representation, a map or a GPS, if you will, in your brain of every part of your body. And even after you lose a limb, so even after you have an amputation, let's say from an accident or from diabetes, that representation is still present in your brain. So sometimes people just get over that naturally, but for those that don't heal from that, we use something called graded motor imagery to help retrain the brain and retrain the nervous system to almost kind of repattern the pain out of your brain, if you will.
Huh, that's pretty fascinating.
It really is.
How does that work? Like, without getting too scientific, because I'm a very simple person.
It's true. He is.
Well, what's really interesting is that, as complicated as pain seems to be, the things that fix it are really simple. So in your brain, there are in your brain, there are mirror neurons. And when you watch movement, these mirror neurons turn on. So for instance, let's say your hand was amputated, as you mentioned. Just by watching someone else's hand move, or by watching your own hand move in the reflection of a mirror, you can train those mirror neurons to actually fire. And when those neurons in your brain fire, it's as if you were actually moving. So as if your brain was actually moving that hand. The other way to do that is actually to imagine movement. So in your brain, you close your eyes or you keep your eyes open, either one, and you imagine your hand moving, let's say grasping for a pencil or for a cup or a glass or lifting a weight, whatever the activity might be. And just by imagining movements, you can turn on those pathways. And when you turn on those pathways, you fire them, and it helps kind of dull that pain sensation or dull that pain response.
This is very similar to one of Norman Doidge's books, The Brain's Way of Healing. Are you familiar with that one at all?
Yeah, I know his book. It's a wonderful book, actually.
Yeah. That just reminded me of you talking about maps and stuff. So I remember there was some stuff in his book. So it's definitely a fascinating world.
Yeah, absolutely. Now, I'm going to cut you off here, Claude.
Yeah, please, go for it.
Because I can. Now, how exactly does pain work? I mean, obviously there's like the brain to the body pathway and the body to the brain. I mean, is it kind of circular, or is it one way? How exactly does that work?
Yeah, it's a great question. So there are what's called bottom-up influences on pain, and then top-down influences on pain. So the bottom-up influences on pain are things like the torn muscle, the torn ligament, the tightness you have in your joint capsule or your muscle or your tendon, the low-grade inflammation you have from eating a poor diet. All those things send danger signals to the brain, and it's up to your brain to decide whether or not those danger signals are sufficient or not to turn pain on. So ultimately, the pain is kind of like the master and the CEO, whether or not pain turns on or pain turns off. But the interesting thing about pain is that you don't need a physical injury for pain to turn on. So if you have a lot of stress in your life, stressful thoughts, thoughts that cause you worry, like thoughts of danger, thoughts of fear, anger, resentment, sadness, all those types of thoughts can turn pain on. Those are what are called top-down thoughts, and they create pain as an output. So those are some of the kind of body and brain inputs as to how pain can actually turn on. But ultimately, pain is created by the brain.
Okay. Very interesting. Now, when somebody comes in with more of the top-down pain, I don't know how to phrase this, I guess, does that go into more of a talk therapy type of treatment, or I know with my practice, most of my clients have no desire to do any kind of talk therapy. So just kind of curious to know how that works in your practice.
Yeah, it's a great question. I think, as a physical therapist, you go into the profession, you think, okay, this is all going to be about muscles and joints and bones and movement. And, pain is a difficult thing for people. So you learn early on that there is a bit of coaching, if you will, that has to happen for people who are in pain. And obviously, we're not talking about acute pain. We're talking about people with chronic pain who've been struggling with pain for a number of years or even decades. What I give people in practice is I give them a simple quiz, if you will. It's called the pain catastrophizing scale, and that's free online. People can look it up. Okay. And it's a really simple quiz, and it tells people how their thoughts are contributing to their pain, and if they're having these quote unquote pain catastrophizing thoughts. I also have a quiz that I invented myself, which is really easy that anyone can use. You can go to this website, thepainquiz.com, and you can take that quiz, and it'll kind of tell you the root cause of your pain, whether it's caused by a movement problem or a nutrition, inflammation problem, or actually your thoughts. But it's really important when you work with clients in whether it's psychotherapy or physical therapy or even the health and fitness world to start to look at how one's thoughts or beliefs influence their pain, influence their beliefs about their health transformation, how it influences their decisions on a daily basis about their health. Health coaching skills are something that everyone can implement into their practice. And, again, I don't sit down with someone, on a couch like Freud did and talk through, how mean their mother was to them. But there are certain psychological points or psychological concepts that I try to get through to patients within a couple of sessions.
Okay, very interesting.
Now, something that's not often talked about, and I think it should be, is prevention of pain. And by the time somebody comes to see us, we could hopefully do something to prevent it. So, Dr. Joe, can you come up with like Dr. Joe's top 3 pain prevention tips, or is that too much off the bat?
No, it's a wonderful question, and we really don't do a lot in our society and our healthcare system to work on prevention of pain. There are a couple of practitioners out there that are starting to work with kids and in schools and different programs, but I would say first, on a nutrition level, make sure you're eating a whole foods diet. So obviously, I tell people, and this is a really good takeaway for people, if it comes in a box, a can, or made by man, chances are it doesn't have a place in your diet for any, long, prolonged period of time. You should have some kind of healthy movement in your life a couple times a week. So you should be moving, obviously have some kind of healthy movement protocol or program in your life. And then last is start to think about what you've been told or taught or what your beliefs are about pain, because there are many myths that are passed down from generation to generation, from parents to children, even from practitioners to patients, that once you kind of bust those myths, oftentimes you will create a different paradigm in your own head about what pain is and what causes it and how you can be healed.
That last part really made me, it gave me like 100 questions. I can't even speak right now. But like, what are some of those paradigms or those things that are passed on that you've found?
Yeah, the first one I think we have to start to look at, just because we have a chronic pain epidemic in our country as well as an opioid epidemic. Mm-hmm. But the first one would be taking a pill is the way to cure chronic pain. And we know that's not the case because we have an opioid epidemic where we have probably about somewhere around 20,000 people that unfortunately die from an opioid overdose each year. We have about 3 million people that are addicted to an opioid. So they've been prescribed opioids by practitioners for chronic pain that has not worked. And we see this in practice all the time. People come in, they say, I've been on an opioid for, 3 years, 4 years, 5 years, and I still have this pain. So the first myth is that drugs are the fastest way to alleviate chronic pain. Mm-hmm. And what's interesting about this is that the CDC and the NIH, the National Institute of Health, came out probably about 8 months ago with the same exact statement. Now, obviously, the NIH has, thousands of PhD level researchers working on this. So we have a lot of great science to back it up. This is not just something we're seeing in practice, but it's also something that is being talked about on a national level. So that would be the first one. The second one that I like to talk to people about are imaging studies. So things like X-rays and MRIs that pain is both a sensory and an emotional experience. So we talked about the sensory before. It's what's found in the joint. But we know that imaging studies, x-rays, MRIs, CAT scans, the things we see on those studies are poorly correlated to pain. So just because you have a herniated disc, just because you have a pinched nerve, just because you have a slipped disc, just because you have degenerative joint disease or some arthritis, doesn't mean that that's the cause of your pain. So those are the top two that I like to start with.
Awesome. I mean, when you said pain can be emotional also, it just gave me a couple images of somebody finding out, that in an x-ray they have an issue, all of a sudden their knee or whatever hurts even more. So yeah.
That's true. And oftentimes, patients look at practitioners in the white coat as the one with all the answers. So all of us have to be very sensitive as to how we deliver the message to people on what's seen on an x-ray. And I tell patients all the time, when you go to a doctor and they explain the imaging study to you, ask them, say, is this a common finding for people my age? And for most people in their 40s, 50s, 60s, even 30s, it's very common to see these, maladaptive or changes that are on an imaging study, but it doesn't necessarily correlate to the cause of your pain 100%. And really what happens, what we're really talking about is fear. People see these images online or in the physician's office, and right away it kicks in a fear response, whether they realize it or not. And fear is extremely correlated with pain.
Now, how do you combat fear?
Well, the best way to combat fear is to educate someone as to what pain is and what pain isn't. So just listening to a podcast like this can many times almost be like a cognitive behavioral intervention. So they start to realize, okay, the arthritis I have in my knee isn't 100% responsible for my pain. So of course I have to strengthen my knee and strengthen the muscles around my hip and become more active. But I also have to look at, what are my own beliefs about pain? What have I been told about pain? What's my current stress level? Am I relying on medication too much when I shouldn't? Am I relying on a surgery when I can probably heal myself without that surgery? There's so many different factors that are involved in decreasing someone's pain response or decreasing their fear response.
So a lot of knowledge and introspection. That's
yeah, lots of it. And a lot of it, does focus around what someone thinks. So you have to kind of tweeze that out. What are they really thinking about pain? What are they telling you? What are their beliefs about pain? Once you can break a belief about pain or a false belief or a myth, oftentimes, and we know this in studies, oftentimes their pain can decrease within 1 to 2 hours.
That's amazing. That is almost hard to believe, but if you look at the placebo response, it's right up there with it. So,
and that's so interesting you bring that up, because oftentimes when we think something is placebo, we actually know that what's happening is there's some kind of maladaptive neuroplastic change that occurred in the brain, but it's now actually changing based on what they've learned or based on what they believe. So if your physician says, okay, this arthritis is 100% the cause of your pain, and I then show you a number of studies and I show you a number of other patients who have a similar x-ray, but they're out doing CrossFit or they're running marathons, and I say to you, how come this person is the same age as you, let's say the same height, the same weight, and everything is pretty much the same, but that person got over their arthritis, but you're still kind of stuck believing that their arthritis is the only cause of your pain? Oftentimes people start to say, wow, it's interesting. How come that person can recover, but I'm still stuck in this pain pathway or this pain pattern?
That's an amazing question, man. And I've just thought of several clients that with arthritis, and to them, I'm going to send this podcast as soon as it's published to them, because I believe they need to hear that.
Yeah, I think as health and fitness professionals, we see this every day, and it's really difficult because our current healthcare system relies so much on an image, and those images are important. Obviously, we want to make sure that you're clear of anything that's awful, like cancer or a tumor, but the truth is those things only happen in 0.5% of the population. And those imaging studies that we see on everyone, those maladaptive changes in joints happen all the time. But we all know people in their 80s and 90s who have zero pain. But if we took an imaging study of their spine or their knee or the hip, guaranteed we would see some arthritis. So it's really interesting to see the influences and how it influences someone's belief in their pain on a daily basis.
Yeah, absolutely. I wish I could remember the story that I heard, but it was something along the lines of there was a study that, we'll just say 100 X-rays were sent to a bunch of back surgeons, and like 80% of those X-rays, the surgeons said yes, they need operative, and 0 of those X-rays the people actually had pain. So the images definitely don't always match the person's experience.
That's correct. And even with some people, they can have awful pain and have a perfect image where there's no arthritis, there's no disc herniation, there's no pinched nerve. And then we have to say, okay, what's really going on here? What's the exact cause of the pain?
Absolutely. And then a lot of times we end up, seeking out some woo-woo thing to try and figure out what the heck's going on, because there's nothing, the experience isn't matching the image.
That's true. So what we're talking about on a bigger level, and I think this is important to bring up for the health and fitness professionals, when we just look at an image or we just treat something with a medication or a surgery, that's what's called a biomedical approach to pain. And that's what we currently have in our medical society or our medical system, where we rely on that first. What we're moving toward very rapidly, and I talk about this in my book, Heal Your Pain Now, is we're moving toward what's called a biopsychosocial approach. And that takes into account the joint, the structure, the function, your strength, your flexibility, the arthritis, but it also looks at a lot of the things that we're talking about on today's podcast and how it influences your entire pain experience.
Now, what do you think about chakras and this sort of spiritual side of the spectrum? Because sometimes somebody will go to a shaman and their pain will disappear after 2 or 3 sessions. Now, what's your take on all of that stuff, Dr. Joe?
Oh, that's an interesting question. I just spent a weekend at a place called Kripalu, which is in Massachusetts. I don't know if you guys know, but it's actually like a yoga retreat center.
Okay.
It's a wonderful place. They have yoga, of course, a ton of yoga classes there, as well as a lot of other different types of healing modalities. And they actually had a chakra class there that I went to. And, it's fascinating to hear other professionals and other approaches to pain. But the one thing we have to look at with every single person who has chronic pain is that in every single one of those cases, in some way, the nervous system is in a hypersensitive or a hypervigilant state. So for lack of a better word, your nervous system, it's like you stuck your finger in an electrical outlet. Your nervous system is just constantly firing. What's interesting about all these types of meditation, chakras, all sorts of energy work is that for the most part, they help people get into a really deep state of relaxation. And when you get into a very deep state of relaxation, it helps to quiet down your nervous system. So for a lot of these types of treatments, there's some type of neurological component, there's some type of central nervous system component to it that's helping people either decrease their pain or in some instances heal their pain 100%.
Yeah, definitely. It makes sense. The more relaxed your nervous system is, the kind of more room you have to breathe.
Yeah, that's true. And even you mentioned breathing. That's why so many people just feel better. And oftentimes when someone is in really intense pain and I can't get them to move in the beginning, I'll just start them on some deep breathing. And within a week or two, they're like, yeah, I feel better. I feel more relaxed. My pain's decreased or my tightness has decreased. So, breathing obviously is a form of movement. Your diaphragm, one of the larger muscles in your body, is actually moving. So we don't necessarily have to move our body right away. We can move other parts of our body, or there's a way to tap into movement that can be approachable to people that helps decrease that overly sensitive nervous system response.
Yeah, it makes a whole lot of sense. I know, teaching people how to diaphragmatically breathe is so important in lowering the stress response and getting people's physiology to just kind of chill out, if you will.
Yeah, it's very true. I mean, because of people's anxiety and their stress levels, oftentimes they don't realize it, but they're working from their computer all day long. Their postures, kind of hunched over. And even if they're aware of their breathing, they're not breathing as deeply as they should be on a, minute by minute basis.
Now, you bring up posture, and I find that's one of the leading drivers of, back and neck pain and even sometimes shoulder pain. Let's get Dr. Joe's top 3 posture tips.
My top 3 posture tips would be, that's a really great question. No one's asked me that. It would be to move once every 50 minutes. So just get up and do some healthy
So that's
movement.
5-0?
5-0, yep. Move once every 50 minutes, 5-0.
I thought I heard 15. So I'm like, some people will discard this information.
That's a lot. Hey, look, if you can do that, that's awesome, and that's a great thing. But 50 minutes or once every hour is wonderful. When you're moving, I really recommend you get most of your joints into some kind of extension. Most of your joints are in a flex position all day long. Your spine is flexed. Your knees are flexed. Your hips are flexed. Your shoulders are flexed. So try to get everything into an extended position. That'd be number 2.
I like that one. That's good. That's money there.
Yeah, I mean, it's huge. I mean, for all your joints, almost every single joint in your body, it's just to work toward extension. I even see people in the gym that are, I watch their programs, and their programs are so flexion based, and I'm like, there's a whole backside of your body, obviously, and
Right.
a whole part of your articular cartilage that's not being lubricated and is not getting some compression to it. So extension is super important. And then 3, I would say tap into what your stress levels are about, because once you decrease stress, you can really affect your posture. And that oftentimes goes back to your emotions. So if you feel confident, if you feel happy, if you feel energized, oftentimes you can take a different postural stance just from having those types of emotions.
That's very true. I know some people, when they feel uncomfortable or if they feel unwell, all of a sudden you'll see they do the turtle thing. Their shoulders shoot up to their ears and they start hunching forward. And it's just so amazing to watch how the mind and the body are connected, and these primal self-defense mechanisms working in today's modern age.
Yeah, oftentimes, especially with patients who have fear avoidance behaviors, where they're scared to move or they're scared to take on a new exercise, I'll have them stand in front of a mirror and, hold their arms above their head and like make a muscle, or put themselves in a warrior stance, something that turns on, kind of a deeper place in them, that, this place that we all have in us. In some level, we all have a warrior in us. We all have a fighter in us. It's in there naturally. But many people have not been told it's okay to be that way, or it's okay to take on that stance. So I'll have people practice that in front of a mirror, either with me there or they do it at home on their own. And within a couple of weeks, their posture, their demeanor, their communication, all of that changes.
That is awesome.
Yeah,
I've never done that with anyone, but I think I'm going to start.
Yeah.
That is.
Well, we see this in physique athletes. They do this naturally in front of the mirror. And many of us can do this on a daily basis to change your posture, which oftentimes changes your stress hormones, changes your pain, changes your tightness, and generally makes you feel better. I tell people to do this before they go into like a big meeting or a job interview where they need confidence. It's a great place to try that.
Yeah, definitely. It's like a form of empowerment that is like
Absolutely.
the body telling the mind like, hey, like, you're the shit, man. It's totally cool. I've got a pretty heavy question. So Brian, do you have anything before I lead into this one?
No, go ahead. I know we're on a bit of a time crunch, so we'll take your question. We'll do some wrap up.
All right, so here goes. So Dr. Joe, if somebody's listening to this podcast and they're currently experiencing chronic pain, what action steps do they take to help themselves get better? Like what should they do first? Should they find out a practitioner? Should they read an article? Should they take a supplement? Like, people are stuck with too much information nowadays. So what would you say, somebody is in really serious pain right now and they can't seem to fix it? What would you tell that person?
I would say that pain really occurs because of 3 reasons. 1, because of a poor diet caused by low-grade inflammation. 2, because of your myths that you hold on to or the beliefs you hold on to about your pain. And 3, somehow attached to your lack of movement or your avoidance of movement. The easiest place you can start to figure out these things is go to my quiz, thepainquiz.com, and take the quiz, and you'll see which of those 3 categories you fall into, or which of the 3 categories you need to spend the most time on or need to spend the least amount of time on. After that, I would say check out my book, Heal Your Pain Now, and I talk about all 3 of these things in that book. And it's really the first book that's been written from this biopsychosocial approach that integrates natural strategies for healing. So it's a really great resource for people.
Awesome. And there's resources in there and action steps people can take?
I have quizzes, I have exercises that people can do, I have some mind retraining techniques that people can work into their life, a number of different strategies that are really easy to implement into your life in that book.
Beautiful.
Awesome. Would you recommend this book to practitioners as well and trainers?
Yeah, it's a wonderful book. I wrote the book myself. So it's written from a clinician standpoint. I wrote it to be really easy for the consumer to digest as well, but it's got a pretty clinician-heavy angle to it. So it's a wonderful book to pick up, whether you're a clinician or a consumer.
Awesome. And is that out right now, or is it coming out?
So it's available for publication on February 7th. So that's when it will be in stores and online. You can find it, of course, on Amazon or Barnes & Nobles. And it's called Heal Your Pain Now, the revolutionary program to reset your brain and body for a pain-free life. And they can go to the book website, which is healyourpainnow.com.
Awesome.
Perfect.
Awesome. And this podcast should be out at about that time. So I think things will line up.
Perfect. So, Dr. Joe, definitely want to be respectful of your time. One of the first questions, or first wrap-up questions we ask everyone is, what is your definition, or who comes to mind when you hear the optimum human?
Oh, that's an awesome question. For me, being a gymnast, I would say any type of competitive or Olympic gymnast are really, they're awesome individuals. I think obviously we look at them first and you can tell that they're strong, they're flexible, they have coordination, balance, all the things that you desire. But I think when you look at that particular sport in general, that one, you have to overcome a lot of fear, because to be on a 4-inch beam or to hang from rings that are 12 feet off the ground and do, all sorts of skills that the human body probably wasn't made for naturally, you really see that there's some type of brain-body connection that's happening there. And in some ways, those athletes have overcome their fear to achieve things that oftentimes weren't possible. I remember being a kid and watching gymnastics and thinking that, oh my God, someone's done 2 backflips. There's no way they could do 3. And then sure enough, a couple years later, someone's doing 3. And the sport just continues to accelerate. And I think that's because the principles of training, as far as physical training, have gotten better. But the principles of sport psychology have gotten better also. And so many of those principles, all of us can apply to our daily life, whether we're exercising or we're overcoming an injury. And we can also apply it to our clients or our patients' life as well.
Beautiful.
Yeah, that reminds me of that 3-minute mile. I believe it was the 3-minute mile. One guy broke it, and then everybody started to break it. Or was it the 5-minute mile?
Yeah,
I'm
totally.
not into running, so.
Not everyone. I still haven't broken the 3-minute mile yet, but we're working on it.
You're still 3:01, eh?
Right. Now, other than your own, if you had to rescue, say, 3 books from a fire, what would they be?
Wow. One would be The Biology of Belief by Bruce Lipton.
Okay.
The second would be Waking the Tiger, which is a book about healing trauma. That's by Dr. Peter Levine. And,
I'm not familiar with that one. I'll definitely have to check that one out.
And the last one is a really it's a really science-heavy book. It's called The Polyvagal Theory by Dr. Stephen Porges, and that describes the vagus nerve and how it influences so many things in your body when it comes to health and stress and vitality.
Awesome.
Sounds right up my alley. And
Awesome.
my next question is going to be, who would you like to hear on this podcast? And what would you like to have them talk about or hear them, ask them?
Oh, on your podcast?
Yes.
I have a really good friend. Her name is Jessica Drummond. She's a physical therapist, and she's just about ready to finish her doctorate in nutrition. And she does a lot of great work around women's health. And I think it's really important to have a woman talk about health from their perspective. And she runs a institute called the Integrative Women's Health Institute. And it's a really wonderful institute that helps women heal from different kinds of injuries and pain and health, as well as fitness. So she'd be a really great person. I'd love to make that introduction for you guys.
Yeah, that would be awesome. I appreciate that. So
Totally.
perfect. Is there anywhere else other than healyourpainnow.com and that people can find you, find your book? Obviously, Amazon.com.
Yeah, and of course they can listen to me on my podcast. It's called the Healing Pain Podcast, and they can find out more about that on my website at drjoetatta.com.
Perfect. And I guess my last question would be, is there any parting thoughts that you would like to leave with our audience?
My parting thoughts would be, if you struggle with chronic pain, just know that pain-free is possible, and we're learning more about pain every day, and to always use integrative strategies to heal your pain, and you'll find the way out as fast as possible.
Beautiful.
Awesome. Well, Dr. Joe, this has been a blast. I think I've taken more notes during this podcast than I have in the last 3 put together. So this has been quite a whirlwind. Thank you for coming on.
Yeah, absolutely.
Great, guys. It's been great chatting. I'll have to have you guys on my podcast as well.
Love to join you there.
Awesome.
Yeah, we'd love to cause some trouble. So.
Yeah, absolutely.
All right.
Well, thanks so much again, and we'll look forward to talking to you again soon.
Thanks so much.
Bye.
Bye now.
Thanks for listening to the Optimum Human Podcast. If you enjoyed the show, please remember to head on over to iTunes and give a 5-star rating and review, which will help spread the word to more awesome listeners just like you. Head on over to theoptimumhuman.com and subscribe to the free newsletter and get the Optimum Humans Blueprint to the Optimum Life. Download it instantly. Thanks for listening.